It is, I'm very happy to share my research. One of my research is my EEG Microstate analysis reviews large-scale brain network alternation in depressed adolescents with suicidal ideation. Part 1, background. As we know, suicide is a serious global public health issue with an approximate rate of 9 suicides per 100,000 people, and the fourth leading cause of death among adolescents and young adults. Suicidation is the first step towards suicidal behavior. In China, depression is a leading factor contributing to suicide, which can increase the risk of suicide 20-fold. It is a report that 1 year prevalence of broadly defined depression increased from 8.3% to 12.9% in 12 to 17 years old individuals between 2011 and 2016. So it is threatening the well-being of adolescents. Now, the assessment of suicidation relies on self-report. However, 78% of patients who die by suicide did not exhibit suicidal thoughts during the most recent interview. Suicide ideation and the associated risk factors may change over a short period. So it is crucial to find objective markers that can evaluate suicide risk. Previous studies have discovered serotonergic HPA axis, noradrenergic, and other neurobiological abnormals. A study revealed that local dysfunction of the prefrontal lobe and impaired serotonergic response are directly proportional to the lethality of suicide attempts. EEG offers an accessible method to monitor the brain's electrical activity with exceptional temporal resolution. Studies have identified the typology characteristic of resting state EEG. As of now, no studies have employed EEG microstate analysis to examine patients with coexisting SI and MDD. Study design. We include adolescents aged 12 to 18 years who have not previously received treatment, diagnosed with MDD according to DSM-5, and inclusions patients with other several mental disorders and individuals exhibiting intense excitability, impulsiveness, or uncooperativeness. Those who have experienced cranocerebral trauma within the past 6 months. And this is research instruments we use. This is EEG data questions. And this is how we're processing before analyzing. This is how we analysis microstate and how to statistically analysis. Differences in indicators among groups were analyzed using one-way ANOVA, following the mindfulness correcting Spearman's correlation was used to employ the associations between parameters. Results. The results showed that there were no statistical differences between the groups in terms of age and gender characteristics. And the second, as shown, we obtained 4 typical microstates commonly reported in previous studies. The mean GEV was comparable across all groups, with values of 0.74 for the HC group, 0.73 for the no SI group, and 0.73 for the SI group. As for duration, we did not find any evidence of group differences in any of these 3 groups. Now, as for occurrence, the SI group had a higher occurrence of microstate A than the HC group. Microstate B had a significantly higher occurrence in the no SI group compared to the SI group. Similar to occurrence results, the ANOVA for coverage also showed a mean effect of the group in microstates A and B. However, post-HC analysis only indicated that the coverage of microstate B was higher than in the no SI group compared to the SI group. This table showed microstate transaction probabilities among 3 groups. The transition probability from microstate C to A was significantly higher than in the SI group than in the HC group. As for the transition from microstate D to C, the HC group had a higher probability than the no SI group. In addition, the no SI group had a higher transition probability from microstate D to B than the SI group. There were no statistically significant associations between age, BMI, and microstate dynamics. However, there were significant differences between males and females for several microstate parameters. Conclusions. In the study, we identified distinct patterns in the microstate dynamics between depressed adolescents with suicidal ideation and those without, many involving microstates A and B, which are associated with perceptual procession. These findings offer novel perspectives on neural understandings of suicidal ideation in depressed adolescents and suggest that microstate dynamics might serve as a potential neurobiomarker for identifying suicidal ideation in adolescents with MDD. There's some limitations. First, the cross-sectional nature of the research limits the capacity to determine whether microstate dynamics have prognostic significance for suicidal ideation and behavior. The second, the feasibility of actualizing these large-scale dynamics for the individual level, identification of suicidal ideation in adolescents with MDD remains to be clarified. And third, the findings are based on an adolescent population which may not be applied to adults with MDD and suicidal action. Caution should be taken when applying these results to populations beyond the adolescents. This is my research. Thank you.
Thank you.